Hello everyone, so welcome to my video on the future of nursing theory by myself, William T. Diaz. So on this video I will be discussing nursing theory, and I will discuss the theory and nursing as a profession, provide an example of a theory and how the core values align with the nursing profession, discuss nursing as a discipline and how it is impacted by theory. I will also discuss the impact of theory on practice, and then provide an example of how theory might guide the science of nursing and research. So before I go any further, I'm going to discuss nursing theory and nursing as a profession. Nursing theory is very complex, but a general and broad explanation of nursing theory is that nursing theory is an organized framework of concepts and purposes that guides nursing practice. It shapes clinical decision making and defines the scope and identity of the nursing profession. Nursing theory consists of organized ideas that explain what nursing is, how nurses perform care, and why nurses perform their duties in the way that they do. Theories provide models for understanding nurse-patient interactions, evidence-based care, and assist with nursing research and education. The three types of theories include grand theories, middle-range theories, and practice-level theories. So now that I mentioned how nursing theory defines the scope and identity of the nursing profession, I would discuss a little bit more about the nursing profession. Nursing is defined as both an art and a science. Nursing profession is regulated healthcare discipline focused on delivering person-centered, compassionate, and evidence-based care. It also embodies compassion, critical thinking, and respect for human dignity. So after an overview of nursing theory and the nursing profession, I will provide an example of a nursing theory that aligns with the values of the nursing profession, and I will use Virginia Henderson's need theory. The nursing need theory provides the framework for nursing practice and the nursing role in assisting patients with 14 basic human needs, and aims to help individuals gain independence to care for themselves as much as possible. Core values of the need theory reflect values such as respect for patient autonomy, holistic care, and compassionate support. It embodies the nursing values of autonomy, holistic care, human dignity, and professional responsibility. Next, I would discuss nursing as a discipline and how it is impacted by theory. So, nursing as a discipline. Nursing as a discipline refers to the academic and theoretical study of nursing, whereas nursing as a profession refers to the practical application of knowledge and skills in a clinical setting to provide patient care. Nursing as a discipline is focused on developing and advancing knowledge that specifically focuses on the health and well being of people. It encompasses nursing theories, philosophies, ethics, and research that build the scientific foundation of nursing knowledge. Let's go over the impact theory has on the nursing discipline. There's multiple ways theory impacts the nursing discipline. Theory serves as the foundation by providing a structured framework that guides nursing education, research, and clinical practice. It helps define the nature and purpose of nursing, shapes nursing curriculum, guides how nursing knowledge is organized, developed, and applied, and most importantly, it directs research that advances evidence-based practice. Now that I have discussed how theory impacts the nursing discipline, I will discuss the impact theory has on practice. So let's go over a few examples or ways the impact theory has on practice and the science of nursing. When it comes to practice, ultimately, it provides structured frameworks that guide nurses in assessing, planning, implementing, and evaluating care. It supports evidence-based interventions, and it allows nurses to establish a distinct professional identity within the healthcare field. It also reinforces the values and ethics of nursing. Similar to the impact on practice, the impact on the science of nursing is it provides foundational frameworks that drive research, improve practice standards, and allow nursing to flourish as a discipline. By defining core concepts, roles, and outcomes in nursing, theory separates nursing science from other healthcare fields. It serves as a scientific rationale for interventions and guides empirical research. So now I will provide an example of how theory might guide the science of nursing or research. The example of nursing theory and research I used was Dorothea Orum's self-care deficit theory. This theory emphasizes that patients recover best when they actively participate in self-care. Researchers use this study and design interventions that enhance patient autonomy and self-management. This eventually leads to studies on self-care programs or post-op recovery strategies. The theory impacts nursing science by developing testable clinical hypotheses, structured research designs, and supports evidence-based practice interventions. And that's an example of nursing theory in research. So to wrap things up, I'm going to give a brief summary of the video on nursing theory and my own clinical application of theory in my nursing practice. So in conclusion, nursing theory is integral to all aspects of the nursing profession and discipline by shaping nursing practice, influencing education, guiding research, and allowing for professional development. Theory enables the development of an evidence-based, person-centered nursing practice. In clinical application of theory in my nursing practice, I will utilize holistic and person-centered approaches. I will also utilize evidence-based nursing interventions while providing nursing care. And this concludes my video on nursing theory. Thank you all.